This video is on cytology and cytopathology. We are from Group 4. Cytology can be defined as the medical and scientific study of cells. It refers to a branch of pathology, the medical specialty that deals with making diagnosis of diseases and conditions through the examination of tissue samples from the body. Cytopathology is a branch of pathology. A common application of cytopathology is the pap smear, used as a screening tool to detect precancerous cervical lesions and prevent cervical cancer. Several samples can be used in cytology and cytopathology. As for vaginal pathology, swab of exfoliated cells is obtained from vaginal vault cranial to the urethral orifice. And as for body fluid cytology, we can get the pleural fluid. Urine sample and samples of respiratory epithelial cells can be used in urine cytology and cytopathology in nasal cavity respectively.
Alright, moving on to specimen collection methods. Before we collect our specimen, we must ensure proper labeling. On the container in which we keep the specimen, we must have the patient's full name and second identifiers such as the date of birth or health card number. We must also put the specimen source and if the sample must be sent to the lab immediately, or also if the sample is highly contagious or highly infectious. Okay, moving on to general methods of specimen collection. There are basically 5 methods, which are touch imprints, scrapings, swabs, fine needle biopsy, fine needle aspirate biopsy, and fluid samples. Alright, the first thing we're going to talk about is fine needle aspirate biopsy. This method requires a needle, a syringe, and it usually is used on skin lesions. Basically, what we do is that we insert the needle onto the skin lesion, and we will use negative pressure to take out a bit of the sample from the patient, and we must take special care so that there is no bleeding in the sample because we don't want any contamination. So the specimen is then put onto a glass slide and preserved. Okay, talking about fine needle biopsy. This method only requires a needle and no syringe. The needle is inserted onto the skin lesion, for example, and the specimen is then put onto a glass slide. Usually, we will take a few jabs using the needle to ensure that we have enough specimen for diagnosis. Alright, now we're going to talk about impressions. Impressions are basically when we have to take a glass slide and we will basically put it on top of the specimen so that we can make an impression on the glass slide. The glass slides are then kept and transported to the labs. This method is somewhat similar to scrapings and swabs. Scrapings are basically when you take a scraper and you take the sample from the patient and then you will put the specimen onto a glass slide and then the glass slide is kept and sent to the lab. In swabs, you do not use a scraper, you use cotton buds usually, and this method is usually employed when we want to take samples from sensitive areas such as the vagina. Okay, moving on to sample processing. There is preparing smears, processing fluids, and also staining slides. When we want to prepare smears, there are 3 methods: push smears, pull or slide over slide smears, and roll preparations. The pictures will show how the method of preparing the smears is done. Now we're going to be talking about the various apparatus and techniques used in cytology and cytopathology in the past and also in the present. We're going to be using pap smear as an example. So some of the instruments used in collecting pap smears are speculum, cytobroom, Ayer spatula, and also pap smear collection kits. These are instruments used throughout the years. So the manual method of processing a pap smear would be called thin prep method. Thin prep method basically has three phases. There is dispersion, cell collection, and cell transfer. In dispersion, basically you have to disperse your sample in a liquid suspension to separate the debris, mucus, and homogenizing cell population. In cell collection, what you have to do is basically the fluid is filtered with the special instrument using a vacuum process. And when in cell transfer, when a single layer of cells are captured, the cells are transferred to a slide for fixation or staining. Now what we use now in the modern day is called Cytek Thin Prep 2000 processor. It's basically an automated machine that processes all these for us, so we don't have to use the manual method anymore. The difference between a conventional spear and a thin prep pap test slide is that when you use a conventional pap smear, you have cells obscured by blood, mucus, and inflammation. But when you use thin prep pap test slide, it preserves the cells more, so we can have better diagnostic findings, and it also minimizes cell overlapping, blood, mucus, and inflammation. Now we're going to talk about SurePath method. SurePath method has a few stages. It is a manual method where we have to pour a density gradient reagent filled centrifuge tube, and we have to keep on letting sedimentation happen to the sample. We have to do this repeatedly and throw away the sedimentation.
Same bed, but it feels just a little bit bigger now. Our song on the radio, but it don't sound the same.
In cytology, if the result is normal, usually we don't say it as normal. We mention it as negative for intraepithelial lesion or malignancy, or NILM. This inclusive for when we don't find any evidence of neoplasia, when there is no organisms, or when there is no other non-neoplastic findings.
Like too young, too dumb to realize that I should have bought you flowers and held your hand. Should have gave you all my hours when I had the chance. Take you to every party, 'cause
If we found any abnormalities in epithelial cells, especially squamous cells, we write it as, first, atypical squamous cells of undetermined significance, or atypical squamous cells cannot exclude high-grade squamous intraepithelial lesion, or low-grade squamous intraepithelial lesion, or high-grade squamous intraepithelial lesion. When there is any abnormalities in glandular cell, we write it as atypical or adenoma carcinoma in situ or adenocarcinoma.
Okay, next is diseases. Okay, about the cervical cancer. Cervical cancer is a cancer arising from the cervix, where it begins on the surface of the cervix. Over time, the cancer cell can invade more deeply into the cervix and nearby the tissue. The symptom that can be seen in cervical cancer is bleeding, menstrual period that last longer and are heavier than before, increased vaginal discharge, pelvic pain, and pain during the sex. The causes of cervical cancer are human papillomavirus, smoking, weak immune system, birth control pill, starting sex at a young age, and have many sexual partners. There are 4 stages of cancer. Stage 1, the cancer cells are only found in the cervix. Stage 2, the tumor has grown through the cervix and invade the upper part of the vagina. It can also invade other nearby tissue, but not the pelvic wall or the lower part of vagina. Stage 3, the tumor has invaded the pelvic wall or the lower part of the vagina. And stage 4, the tumor has invaded the bladder or rectum, or the cancer cell have spread to other part of the body, such as the lung.
Next, we'll go about management of waste, human anatomical waste, animal waste, microbiology and technology waste. They remove through incineration or deep burial. For sharp objects, we either remove through incineration or disinfection or chemical treatment or mutilation. To remove medicines and cytotoxic drugs, we remove through incineration, destruction, and disposal in secure landfills. Meanwhile, to remove solid waste such as blood and body fluids through autoclave or chemical treatment or burial. For solid waste such as disposal items, we remove through autoclave or chemical treatment or burial. For liquid waste such as blood or body fluid, we use disinfections by chemicals or discharge into the drains. For incineration ashes, we dispose in municipal landfills. To remove chemical waste, we use chemical treatments or secure them properly.